Something that I do, by the way, I don't know what you think about this, but like I look at my genetic predisposition also for each of these nutrients. So for some of them, the predispositions are better than others. For example, like certain nutrients like zinc is pretty good. It flagged that I had a higher need for zinc, and I've always had a much higher need for zinc than like my serum zinc is always low if I don't supplement with it. Gives you an idea of at least what tests that you might need to take. It's a broad idea. You could look at many things and see like, okay, this I likely need more of. Then you could take the test and see if you actually need more of it.
I'd like to ask Chris's thought on this thought process, which is that, so say, right, Joe, you developed a polygenic risk score to predict serum zinc, right? They had a whole bunch of people, they did their genetic tests, right? So you have all their SNPs, and then you measured their zinc. So
We do have
yeah,
a
if
polygenic
your
risk
if
score
your
for it,
polygenic
yeah,
risk
but yeah.
score predicts that you have lower circulating zinc, that's likely to be the case, right? Statistically. And so that's a
Correct.
self-fulfilling prophecy. Does that mean that that lower zinc is actually biologically relevant? Or does your body function just fine with a slightly lower circulating zinc?
Well, I'd love to see validation studies of it. My suspicion would be that the polygenic risk score would have a component that may reduce your need for zinc and a component that may make you more vulnerable to zinc deficiency, and that you would have to fish out that heterogeneity. And I'd love to see studies validating it as well as validating like different ways of calculating it on that basis. What is well validated is that when your plasma zinc gets down to 70 or 75, you're at the edge of developing clinical symptoms. And if it gets down below 50, you have big problems. And if it gets lower than that, you have severe problems. I don't know that I would modify those numbers with a polygenic risk score unless you could kind of repeat the repletion studies, but stratify people by their polygenic risk score. But if you did that, you would want to look at the polygenic risk score not for, and I don't know the components of yours, Joe, so let me know if you've addressed this already, but you would want to separate it into polygenic risk score, not for things that predict a lower plasma zinc, but things that predict aspects of that would increase your need for it, some of which would be a higher plasma zinc. So like if you have a defective zinc transporters, there are a bunch of them, and which ones they are will dictate uptake into different tissues. Some of those might decrease your plasma zinc if it's like better transport from blood into certain tissues that where you would be most likely to develop a clinical symptom, but others might increase your need, especially if you're just not absorbing it from the intestines. So if you can sort of mechanistically ferret out the cluster that you think would genuinely make you more likely to be deficient, then I would love to see a repeat of those. This will never happen, but I would love to see a repeat of those depletion repletion studies from the 80s, stratified by the sort of need for plasma zinc score to see if the clinical symptom. And I guess there's a way you could crowdsource that in a less experimental way or less controlled way as well. That would also be interesting if you had a bunch of people testing their plasma zinc and reporting whether how often they get sore throats. It'd be very interesting if you had like genes that could predict a different level of plasma zinc that predicted a sore throat. So I actually feel like most people have too much information, and I'm generally trying to whittle down the information to small bits that we could put more weight on. And I actually think that's where the best utility from this stuff would come from. So like a lot of the risk stuff is sort of like, where am I in the middle of some spectrum? Am I on like 10% to the left or 10% to the right of the middle? There's a huge amount of that stuff that would have very little utility in my framework. Whereas if there's something that can help me understand something anomalous about what I would have done anyway, right? Like, so the interesting things about genetics to me is, why am I doing one thing that by all metrics should do X and it's doing C? It's not even doing Y. It's doing C on the total opposite of the spectrum. I think that's a smaller amount of the information, but I think that's where the real golden nuggets are, because I would have tested my plasma zinc anyway. And if it was 70, I would have taken zinc anyway. But if I find something in this that could explain why my behavior is anomalous to what I would have expected, then I think that's sort of like the golden nugget that I would hone in on. And I know that I don't remember what they are, but I know you do personally have some of those, because we've talked about them the last time that I was on, with tryptophan handling and stuff like that. So, and that was also what caught my attention when we were talking, was just about these anomalous things where I'm like, yo, that's not normal. Like you must have something wrong with your tryptophan handling, because it's not normal to need that much of this thing to make this thing happen.